All right, so we're going to talk about the rib cage now. So here is a typical rib. I think it's pretty identifiable to, if you see this bone has a nice little kind of curve to it, slender shaft, thinner bone. These are ribs. Some structures to identify on this rib is, so if you see this end that's super flat, this is going to be the end where you'll find the costal cartilage connected that will eventually reach and connect to the sternum. Whereas this end is a little more rough and we see some prominent features, this is going to be the end that's going to connect with the thoracic vertebrae. So remember, ribs will connect to the thoracic vertebrae. So there are 12 thoracic vertebrae. There is a rib that's going to come off of each side for a total of 24 ribs, right? 12 pairs of ribs, 24 total. So here, again, super flat end. This is going to be the costal cartilage end, whereas this is going to be the end that articulates with the thoracic vertebrae. This kind of prominent structure that extends, right? It kind of enlarges. This is the head, whereas this more slender portion, this is going to be the neck. And then this rough kind of ridge, this is the tubercle. These are all structures that are going to articulate with the thoracic vertebrae. Okay? And then this is the shaft of the rib. And then again, this will be the end that will have costal cartilage attached, and that costal cartilage will then connect to the sternum. This is showing you the sternum and the costal cartilage. Costal cartilage is made up of hyaline cartilage. This big chunky piece up at the top, this is called the manubrium of the sternum. The manubrium of the sternum. We can see this will be the costal cartilage of rib 1. Okay, so rib 1 connects to the manubrium. And then these little notches, these are called clavicular notches. This is going to be where the sternal end of the clavicle articulates. Right, so the sternal end of the clavicles sit right here. This is the manubrium. The slender middle portion of the sternum, this is called the body. And then this pointy triangular bottommost part, this is called the xiphoid process. And this is what you have to be careful with when you're giving someone CPR compressions. It can very easily break, and if you're pressing too hard, and it can go down and puncture vital organs and cause internal bleeding. So manubrium, body, xiphoid process. Okay. And then here, this is just showing you an articulated skeleton. The ribs, again, so if I show you the posterior side of this articulated skeleton, anywhere where there are ribs attached to the vertebrae, those, if you count, look, where ribs are attached, 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12. There are 12 thoracic vertebrae. Each one has a pair of ribs connected to it. Okay? Those ribs are going to come from posteriorly, wrap around the thoracic cage anteriorly. Okay? Now, there are true ribs and false ribs. Okay? True ribs will be the first 7 ribs. So if I count 1, 2, 3, 4, 5, 6, 7. 1, 2, 3, 4, 5, 6, 7. All right? So these are called true ribs. True because their costal cartilage connects directly to the sternum. So those are considered true ribs. Now, the bottom 5 are false ribs. If you look at, so this would be rib 8, 9, and 10. They still have cartilage, but their costal cartilage will connect to the cartilage of rib 7 before going to the sternum. So they're considered false ribs, but they still have cartilage, right? Now the bottom, this would be, so if this were 7, 8, 9, 10, 11, and 12, these are called floating ribs because they lack costal cartilage. They don't connect to the sternum at all. But they're still false ribs, but they're considered, we have a special name for them called floating ribs. Okay? You'll also hear these referred to as ribs 1 through 7 can be referred to as vertebrosternal because their costal cartilage connects directly to the sternum. Now ribs 8, 9, and 10, you can hear referred to their technical specific term. You can call them vertebrochondral because they connect. So vertebrosternal means they connect to the vertebrae and the sternum directly, right? 8, 9, and 10 can be called vertebrochondral because they connect to the vertebrae, but then their costal cartilage connects to the cartilage above. So vertebrochondral, right? Considered false ribs. And then 11 and 12, those can also be called vertebral ribs because they only connect to the vertebrae. They don't connect to the cartilage and they don't connect to the sternum. So they're just called vertebral ribs. Right? All right, so you should know the difference between true and false ribs.